The average patient that comes in for botulism toxin for the first time is often a patient in their 20s or 30s. This may be someone who has very fine lines, or they really don't have much in terms of deep lines. They're more looking for prophylaxis or preventative treatments. But then we also do have patients that have kind of waited a while and they are a little more advanced in age and may have deeper lines, but everyone's muscle movement, facial structure is quite different. So we may have a patient who comes in who's in their 40s, who has no static lines, who it's very appropriate to wait, and we may have someone in their early 20s who has much deeper lines. It's often, again, genetic, also based off of potentially stress and other environmental factors. So it very much is an individualized question. I can't say, the exact age, but I'd say approximately 20s to 30s. But really, once you start to see static lines in the mirror, now's the time. Once you start to wait where those lines are much more furrowed and what we call like deep righted, sometimes it takes either a much longer time to get them to relax, or there's no amount of neurotoxin in Kansas City that could actually get those muscles to relax. So it's better to start sooner than later, but you also don't need to start at a very young age unless you want to start prophylactically. So the age you start Botox, it does not necessarily correlate to the age you will stay at. There are a lot of other treatments that we look at when a patient comes in as a new time patient. So men and women, as we start to age, we're losing collagen and elastin, the fat pads are shifting, our skulls are shrinking, and everything that was nice and tight starts to move down south. There's many places where we can inject Botox, but there's many places where we are unable to inject Botox. So in terms of staying forever 29, there are kind of a multitude of treatments that are synergistic together. And when patients come in, as for a new patient, we can sit down and have an extensive conversation. We talk about a short-term plan, maybe a medium and long-term treatment plan, so they can stay forever 29 and stay at the same age that they started their Botox.